My name is Bill Richards. I'm one of the physical therapy assistants here at OSC's physical therapy department. And this is Jamel Thomas. He's one of our exercise technicians, which at least helps the patients go through their program. And one of the things that I'm going to do today is talk about Physio Tape. Now, a lot of you have probably seen it maybe back in last year's Summer Olympics, where typically you saw the volleyball players with all this colored tape all over their body. So it's kind of an interesting tool that we use here in our clinic. What I'm going to use and demonstrate today is what we use for lateral patella tracking. So a lot of times when you have some muscle imbalance or some knee pain, what happens is when the patient contracts their muscle, the kneecap wants to come this way. So usually that's an indication there's a muscle weakness or tightness of one of the two areas of the legs. So usually if this is really too tight or stronger, this is the weaker side, he contracts his patella and it comes this way. So what we want to do, which can obviously cause some irritation to the knee joint. So you think about like your car being out of alignment. What happens when the tire's out of alignment? It pulls to one side to the left and you go in and get that corrected. Well, patella is kind of the same thing. That's the way I kind of describe it. So if it's too strong on one side, either one, it can go this way or this way when it contracts that muscle. So what we're going to do, we're going to do a piece of Kinesio tape, and we call it a lateral patella block. So we're going to assume that Jamel here, when he contracts his knee's coming to the outside. So a couple different ways you can do this. I'll just show the way pretty much standard here in the clinic is we split the taper on the back. You can see it kind of stretches a little bit, kind of gives. And what we're going to do, I'm going to put right along about the middle, what I call the middle of the patella, right up against it. So we're going on what we call the lateral side of the kneecap. I'm going to kind of secure it, kind of rub it down a little bit and just get a little bit of tension as we go around his knee just like that. So you can see that also kind of acts like a cup, or if I put my hand here and block this, it's kind of the same thing. So now when he goes to exercise, he can have less knee pain because now we're helping some of the structure of the kneecap, making sure it slides more correctly inside the joint. The interesting thing about the Kinesio tape is that because it's kind of elastic, what it does, it kind of causes a little bit of a separation in the tissue, of different layers of the tissue. So if you have a lot of swelling there, that helps that swelling or that fluid help kind of flush out. But also by increasing that space, it also helps the joint to function more properly, or the muscles function like they should. So what we usually also add to this is what we call a patellar huggy. So all it is kind of a simple thing. It's just like what you kind of would think something hugging something. You're going to put two pieces of tape that kind of wraps around that knee that also helps support this piece of tape right here. So two kind of work hand in hand. So I'm basically going to put the anchor right below the kneecap, or the tibial tuberosity we'll call it. And then we're just going to come sweeping around, very similar to this piece here. Almost like we're just trying to put in a big little target, I guess, whatever we want to call that. So a lot of times what we'll do this before the exercise, give it a little extra support. Usually this will stay on for about 3 days. Typically, a lot of times we've seen it up to 7 days. The nice thing also about this is if you have a latex allergy, you don't have to worry about that because it's latex free. That's it. So usually people get a lot more relief with their pain, because usually the knee pain, obviously there's going to be inflammation there, and there's also, like I was saying before, it helps that inflammation as far as decreasing it because it opens up the space in the tissue, or different layers of the tissue, so the fluid can flow through.